I want a beauty that will give me that glow. The kind of body that'll make them say, whoa. Get it right with the knife who slays. Beauty and the blade. Yeah. Get it right with the knife who slays. Beauty and the blade. Get it right with the knife who slays. Face and body. And the blade.
Welcome to Beauty and the Blade. We are super excited to have you back. And we have a wonderful premier guest here that we'll introduce in just a moment. And my lovely, lovely angelic wife here.
Hi, guys.
Hi, Ashley. So I would like to introduce our guest, who is actually a very near and dear friend to us, Janelle Suggs.
Before we get into all the goods with you, Janelle, I just want to express how much I enjoy your presence. I think I've told you, so for all of you that don't know, I met Janelle. She is our children's school therapist. And just when she enters the room, she has this graceful, peaceful, I feel like she's just connecting my
soul.
Yes, I love it.
I agree.
And the things that you do for people are unbelievable.
Yes.
So everybody, please welcome Janelle Suggs. So today we're going to be talking about, not plastic surgery, psychology with plastic surgery.
Correct.
What do you feel, Janelle, that is should somebody get a psychologist to evaluate them, or what do you feel about that?
Yes, and I think that that's pretty standard care. It keeps people safe. It helps manage expectations.
Right.
It helps with recovery.
Mm-hmm.
Lots of education, lots of psychoeducation, that bit. And then that eval helps assess if somebody is a good fit.
Right.
Right.
So, I think that I read a study a while back. I firmly believe that patients that are going under gender transformation, they 100%, we do require our patients to have a psychology evaluation. But some of our other patients, when it starts to dip into body dysmorphia, they're just never satisfied. So if they had that evaluation, do you think that would be more appropriate?
Yes, and they are not a candidate. Clinically, they're not considered a candidate if they are showing signs or have been diagnosed with BDD, which is body dysmorphic disorder. You would want them to do the work prior to their treatment or to their surgery, pre-op.
Right.
You'd want them to get.
Body dysmorphic disorder is something that I certainly am not trained to diagnose, but what are some of the clues or the signals if I'm going to evaluate a patient for a consultation, and would be some red flags where I would say, hey, yeah, she probably or she needs to be evaluated?
Stuff that we should look out for.
And so the criteria is one or two or more perceived defects,
Okay.
physical defects that cause a tremendous amount of chronic discomfort or psychological discomfort.
Right.
It looks a lot like OCD.
Okay.
They will report doing things over and over, like excessive tanning or covering their ears constantly. If somebody is struggling with something with their ears, you'll hear it.
Right.
It's repetitive behaviors,
Right.
constant. They only speak of this. It's an obsession.
It's an
Right.
obsession.
You'll hear it. They ruminate about it. It will be top of the and only part of the conversation.
Right.
And then you really want to validate that.
Yeah, and I'm so happy that you're explaining this, because I feel that my thought of body dysmorphia was always that patient's just never satisfied. They just keep coming in and fixing themselves, but they're never mentally satisfied.
Yeah, physically, mentally.
Physically, yeah.
Fixing themselves.
Right. So I like that you explain that a little bit differently. And
So in terms of body dysmorphic, what areas, for example, so I'm just going to throw myself in the mix. Let's say a person is coming in, we'll separate into body versus a facial. I feel like, for example, rhinoplasty, at least in our field, is one that is high on the list for someone that could potentially be dissatisfied or body dysmorphic. What areas of the body do you have you treated where you're like, well, this person has some BDD issues?
There's a wide range. I worked with victims of crime. So there's the people coming in with trauma that have had, something, they have been victimized.
Right.
Then there's people that have been bullied. So it can be nose, ears.
Right.
I think those are chest, the breast.
Right.
Those are probably the ones that you see often.
Right. I think weight is a big issue in this country as well.
Right.
I don't know if, again, they're bullying about, whether they're overweight and things like that. Do kids?
You do,
Great.
and you see it also through a cultural optics lens. So culturally, depending on how they identify or what culture they're comfortable or have been raised in, then that will have an impact too on the way they see
Right.
themselves. Some cultures, they celebrate weight.
Right.
Some cultures celebrate a larger nose.
Right.
Some cultures celebrate, different sizes of different body parts.
Right.
We see it usually. You'll hear BDD starts to show up in adolescence through bullying, and then it will become chronic. They're trying to treat themselves.
Right.
Cover their ears or hide their nose.
Yeah.
Yeah, so
That's a
it
tough one.
definitely it comes from the younger age. And how do you, I was going to say deal with, but how do you treat that younger patient of yours that's going through that? Say they started, this has been happening for about 2 years and now they're 11 years old. What are your steps of helping them? Can you get them out of that BDD?
Oh, yes. The treatment process depends. It's case by case, depending on what they're working, what they experienced.
Right.
But the interventions, you can start with CBD,
Okay.
CBT,
Okay.
cognitive behavioral therapy.
Okay.
And that is a process where you help externalize the problem and or whatever they think that's going on with them. If it's a physical issue, and then you work on how their experience has been. It's really, honestly, it's case by case.
Okay.
It depends on when it showed up, how it showed up, and then you want somebody to advocate for themselves. You want to help them to become more assertive, because you don't want them to carry on post-treatment the traumas that they may have incurred through bullying or.
Right.
You want to help people get to a place where they're a bit more in control. They have a bit more self-confidence.
Right.
There's many different interventions, but CBT is really a good place to start.
Okay. Yeah. So now that we've talked about body dysmorphia, because we've discussed that briefly in other segments that we've had, and it was really hard for him and I to discuss that when we don't really know, we don't have the knowledge on that. Do you want to talk about anything on that? Because I have a personal question to ask her.
Well, I mean, in terms of my patients, I feel like most of them have realistic expectations.
Right.
Of my limited knowledge, I'm trying to see if there's any red flags of unrealistic expectations and such. But, one of the things, unless you want to jump in, I wanted to get into, is there is kind of, after recovery, kind of these mental highs and lows of,
Right.
regret, sometimes even a mild depression, almost
Yeah.
like we talk about postpartum depression from a very big, life-changing event, that surgery in and of itself can cause kind of, we call them
Post-surgery depression.
post-op blues.
Yes.
So how would you say one could prepare to deal with that or be better prepared?
Talking about it before. Educating, psychoeducation, it's such a big, important part in any kind of procedure, any changing event in your life, any plans to do something different in your life.
Preparation.
Yeah, psychoeducation is really big. All the things to consider, so it doesn't sneak up on them. And then if you can encourage them to have a team of their core group or a therapist that they're working with to speak with them on an ongoing basis about this event that's going to occur, a procedure, a cosmetic procedure, to make that an important part of their discussion with their therapist or their psychologist, whoever they're
Right.
working with.
Yeah. I was one that I actually went through that. And it was actually, I remember it was when I had my nose done. And it was good that I couldn't go, I could have went out in public, but I didn't. And I actually had my upper eyelids done and my nose at the same time. So I just had to disconnect from the world. And that was probably the best recovery that I ever had, because I felt that in other procedures, I was so focused on healing, and you don't see your body you just want that instant, result. And you don't see that happening. So it starts to give you the post-op blues.
Did you experience that during the upper lid rhino?
You know what?
recovery?
I felt that it was really good to be alone and just to be centered on my own personal thoughts. And I probably a few months prior to that, I did start seeing a therapist. So it was really good. And she was having me do these different activities or, things like she calls it my homework. And it really helped because I wasn't doing my homework. I was a bad student. So it really helped to have my own time, and I wasn't able to look at things on my phone. I wasn't able to watch TV. My eyes were all swollen, So I just got to disconnect. And I feel like at that time in my life, like I really needed that. And I still nowadays go back to it's all about meditation and just canceling out the world and just be
Being present.
be
for sure.
present. Yeah.
But it sounds like, what she alluded to is that you were somewhat prepared, like you said, with some previous discussions. And I think, what we're all alluding to is we want the patient to be prepared and also in the right state of mind
Right.
to handle. It's a pretty traumatic event to go through a procedure that's altering, your figure and
Right.
yourself. So I think the preparation is what kind of helped you,
Right.
You're also familiarizing yourself with a new person.
True.
Yes.
And I think that
Very
the
good
advice or the
Yeah.
suggestion through your provider or whoever you're seeking support with,
Right.
it's good to check out from anything exterior of yourself and check in with yourself.
Right.
Because it's something new in your life, a new relationship.
Yes.
And it's
Absolutely.
great to be an advocate. I hear it so often, people wanting to start over, a new beginning,
Right.
a new chapter. They'll frame it as that. And part of that is doing something for themselves.
Right.
Right.
Something that they've been struggling with, something that they've wanted to change or alter to feel better about themselves, someone that has given so much of themselves, raising a family,
Absolutely.
and then they
Yeah.
want to take a little bit back for themselves. And it's a great suggestion through your provider or your therapist that you're
Yeah.
working with to say, don't look outward, look inward.
Right.
And have that time with yourself to familiarize yourself with yourself and
Right.
that how you look anew.
Right.
But you touched
Yeah.
upon a very important point, because my most common procedure is, for example, a mommy makeover where, they're obviously reconstructing the tummy and the breasts. And I always look at moms that y'all are so giving and sacrificing your entire lives for your children, your husbands, your jobs. And, I frankly don't know how you guys do it. And it's almost like you guys put yourself last. And so when they come in for a tummy tuck consult or a mommy makeover, I literally tell them, you deserve this.
Right.
And yet they still feel somewhat guilty because they're so sacrificial in their generosity, moms, and their time. And
Right.
so, I think even accepting oneself that, I kind of deserve to take care of myself is kind of an important praise and support.
Yeah. You know, and I
for-
just think that women, or it could be a house husband, a housewife, I
I'm a
feel
house
like, really? You want to try that for a week?
Maybe a day.
I feel that as now I transformed from being at the practice, you know, constantly
to
to now being at home.
full time.
I think that we don't hear it enough that it's like, you're doing a good job. You know, and I've been trying to be so much better with affirmations. You know, I think that is a big thing. Just telling yourself, because I don't know about you two, but somebody can tell, I take, even though I'm saying, like, I would love for somebody to say, you're doing a great job, but when people do say that to me, like, oh, you look so beautiful today, oh, I don't know how to take that in. I don't know how to accept that.
How would you diagnose that?
Oh, I'm a crazy case. I don't know if you're I'm just kidding.
The list is long.
I think that it does take time, and you have to really develop these new relationships with yourself as you go through different life
Right.
changes, right? As you age, as your relationships with your family change as they
Right.
get older. There are all so many different moving parts, and it can be difficult because when you're raising children, it's pretty much just them. So you're so much about giving
Right.
and not receiving.
Right.
So also part of your therapeutic process would be incorporating potentially empathy,
Uh-huh.
empathizing with yourself. I always encourage people to finish the sentence.
Yeah.
You know, I don't receive compliments and then empathize with yourself because I've been giving so much to my wonderful children that
Yeah.
I've done a great job raising,
Right.
and there are great humans. And really give yourself that break.
Yeah.
But so many people, you hear them, they'll just cut short of that. I don't receive compliments well.
Right.
And then in the therapeutic process, you'll say, well, why do you think that is?
Right.
And what does that look like? And you want to help unpack that. And
Right.
again, if somebody is not meeting the criteria for BDD, body dysmorphic disorder, then you want to jump right in and help support them get to that
Right.
new phase, that new stage.
Right.
You want to really go by the will of the patient.
Right.
So going back to plastic surgery or even fillers and such, if I were to ask one leading question to a patient, because admittedly most of my patients are very, even-keeled, great candidates for surgery, but if there was going to be a red flag, what could I ask them to see that they were ready for, a big procedure?
Transparency. I would ask them. I would want to know their expectations. We do that clinically as well. What are your expectations, and what's worked and what hasn't worked? And what are your greatest concerns?
Okay.
And through those simple questions, people will just
Kind of
open up
deliver.
and you just want to be really, I already know you, and you're very empathetic and sympathetic and wonderful.
thank
Both of you
you.
are so great.
Thank you.
I think all your patients are in such good hands. I would just suggest just asking them,
Yeah.
straight out, what are their concerns? And I think
Yeah.
that a lot can be revealed from those simple questions. They're very casual questions. They're not
Right.
clinical questions, so people feel a little bit less pressure to open up.
I love that,
No, I do too. I just love that you explained body dysmorphia to me, because I had a different vision on that for many years, and it just dives so much deeper into the background of that.
But
There's a danger zone with body dysmorphia too that we didn't touch on, that they have a high rate of suicide. So it's something that if you do notice in a family member, you want to have that looked at. You
Right.
want to have them seen to assess for that.
Yeah.
And we know that the younger you are, the more resilient you can be.
Yes.
So, if somebody sees that, try and help them address that family member, that friend, help
Yeah.
them have a
Okay.
deeper look at
You know,
that.
I think when I heard you, it's so great that you mentioned those really basic questions, because admittedly, I'm going through a consultation, I'm going through what are their goals, what do they want to achieve, but in the end, what you mentioned about expectations, that's exactly what I'm trying to meet. And oftentimes it doesn't even matter what the surgical result is. Sometimes I look at a surgery result and I'm like, I could do better. But the number one first question I ask is, how are we doing? Are you happy? And if they're happy with the results, it's like that's the win, right? It doesn't matter how perfect. If they've perceived a happiness in themselves, I feel like I've met their expectation.
Right.
So I think, like you said, asking that from the get-go, I think is really, really, it's
Yeah.
something that I'm going to incorporate into my consultation process for sure.
Yeah, that
Yeah.
psychoeducation bit's really
Yeah.
helpful. It helps people build that bridge
Right.
and prepare.
Yeah, I like that.
I
So
love it.
I want to go to something kind of personal. So I want to know your opinion. So this is completely out of medical. Just with family, parenting, why is this such a hard job? Like I don't
easy.
know when is the appropriate age for dating. When is the appropriate age to get a phone? When is, I have all these questions for you.
It's very
I
tough.
have a lot of answers.
Yeah, I love that.
Session.
I have a lot of supportive answers. I
Yes.
don't know. I don't have the answer.
Right.
Again, it's case by case.
Yeah.
Family, depending on culturally, how you align, where you live, religious aspects. It's so unique for every family that you really should look at it as being your own creator, your
Right.
own creative thinker.
Right.
The things to consider are when you're addressing a concern, dating, that's a great concern, right? You
Right.
want your young ones to be prepared.
Right.
Not prepared, am I? Ever.
I don't know if we ever really are. I
Right.
mean,
Yeah.
I do the math all the time. I'm like, oh my gosh, in a few years, I'm going to be
Right.
so less important.
Yeah.
But I think that knowing the most about yourselves, what's important to you, what do you want for your family. Many families come in and will out the gate start talking about what's happening in their family, like a family session.
Okay.
And I will go to each parent or talk to the family about planning anything. And even a vacation, there's a tremendous amount of planning. But
Right.
if you ask what a family wants for their children, they'll say, I want them to be happy.
Right.
And you're like, wow, that is a very, large,
Yeah.
loving statement, but it really has no roadmap,
Right.
right? So how do we plan this as a family? What does that look like for us this year? What does that look like for us in 2 years? And really nobody has any idea. And so when the children start hearing their family speak, then
Right.
everybody kind of starts sharing, oh, this is important to me. I would like to be doing this. Athletically, I would like to be here academically. I would like to be here, on a vacation one day. And so the
Right.
family starts to build a roadmap, but these conversations somehow go missed and they're more assumed.
Right.
But really, we encourage people to look at themselves case by case internally, not
Okay.
what your neighbors are doing, because your
Right.
neighbors
And I feel
could
like
be,
a lot of us do that, right? It's like, oh, well, the Joneses, they're doing, and it's like, okay, it just depends on the individual. And I like that you
and
said
what's
that.
important to that family.
Yeah.
Some people are very religious.
Right.
Some people are, practice their religion in their daily life and aren't part of a religious community.
Right.
It could be cultural.
Right.
Too. It depends. And so we address it case by case. We find out what's important to that family and long term, what do they want for their children? But we help them to unpack that.
Yes.
Because everybody will, of course, say, I want my family to be healthy and happy. Okay, well, what does healthy and happy look like to you?
Right. Right.
And what does that mean? And the children need to hear that, because they say, my parents want me to be happy, but they don't really have a roadmap, and we need to be that guide.
Right. Right.
So I think a key point that I'm hearing is that as parents, we need to listen more to our children. And I know you and I have talked about praising them, listening to them. I'm reading a great book called Sacred Parenting, and it's almost as if our children are our teachers. I mean, I learn more from them as I'm instructing, but in order to do that, I feel like I need to listen more you know,
Yeah.
and have those conversations with our
And that's just
children.
like with every individual. Like, don't you like to be heard? I like to be heard, you know? And
I like to demand.
Yeah, these little humans, like, they just want to be heard, you
And
know?
understood.
Not always like, no, don't do that. You do this, you know? They just want to be heard.
So I want to end kind of on a happy, fun note. I do want to talk about Janelle's
Yes.
interests. She's got 3 different interests, and I wouldn't call them obsessions, but she talked about, tell us a little about your animals and order and sense and such.
I think my husband would argue, and my daughter too, that they are obsessions.
Sounds
But-
familiar.
I do. I love animals.
Yeah.
I'm from Texas originally, and so I don't know how we come into contact with different species of animals. It probably wasn't legal. My cat would catch animals, and then I would think that they were gifts, you know,
Right.
from God, and I
Yeah.
would raise
Oh,
them.
wow.
How cute.
Yeah, ground squirrels, raccoons,
I love that you had a raccoon.
a duck,
I didn't know
A
you
duck
could
is
have
so
that.
indoors.
Yeah, that's
It-
so cute.
Made a home in my bathtub, as we all do.
Yeah.
I'll remember for us not to do that.
He's like, please don't give her any ideas.
All right. Well, that time went super, super fast. I can't believe it's been already nearly half hour. We'd like to certainly thank Janelle
Yes.
for
And-
just really educating us
And
on.
if you guys have any questions or you want to get in contact with her, we will be sure to link all of her information. She does school counseling and then also one-on-one in her private practice.
Right, as a licensed family and marriage therapist. So we're super thankful. I think it's a very important topic that we need to keep talking about. We're super happy. If you'd like to follow us, again, faceandbody.com, faceletterandbody.com, and follow us on the Instagram at Face and Body Plastic Surgery, and give us a call at 1-888-900-9065, 1-888-900-9065.
Thank you so much, Janelle.
Thank you for
Thank
The
having me.
time like
you.
flew by.
It did.
And if you guys want to catch us again, we are going to be here every Sunday morning at 7:30 on Go Country 105. Beauty in the Blade, where beauty begins.
Oh, I want a beauty that will give me that glow. The kind of body that'll make them say, whoa. Get it right with the knife who slays. Beauty and the blend. Yeah, get it right with the knife who slays. Beauty and the blend. Get it right with the knife who slays. Face and body in the blend.